My name's Tracy Johnston. I'm a consultant obstetrician at Birmingham Women's Hospital. So I'm a doctor and I look after women during pregnancy. I'm also the Deputy Chief Medical Officer, which means I've got quite a big management role in the organisation of the hospital as well. When COVID vaccines were rolled out across the country, pregnant women were initially told not to have the vaccine because there were concerns over the safety. That has changed massively. Huge numbers of pregnant women across the world have now had the vaccine. We now know very clearly that the COVID vaccine is safe, but we're now playing catch up because lots of pregnant women either are still very frightened because of the warnings that were put out before about to avoid it in pregnancy, about misinformation that came out about COVID vaccine can stop you getting pregnant, it can affect your fertility, it can cause miscarriage, it can affect the pregnancy, it can damage your unborn baby, all of these things. So women are still naturally quite wary and frightened about it. It's also trying to get the health professionals to understand that now this is safe. And there's lots of data out there now. We know that the COVID vaccine is safe in pregnancy. There is no evidence at all that it stops you getting pregnant. There is no evidence it increases the risk of miscarriage. We know it doesn't cause abnormality in the baby. And we know that your risk of having a reaction to the vaccine is no higher if you have it in pregnancy. Now, quite a big, almost government campaign to raise awareness and to encourage pregnant women to be vaccinated. And the reason for that is that when you look at different cohorts in the population as to who's not been vaccinated, the pregnant population make up quite a big cohort because of all that misinformation and lack of access to the vaccine that there was before, and the fact that a lot of the safety data that we've got now we didn't have before. But the impact of that is that we are seeing pregnant women with COVID who are really, really sick. And if you look at that on a national level, and there is now very good evidence, the National Perinatal Epidemiology Unit in Oxford have published through Embrace confidential inquiries looking at the impact of COVID in pregnancy. And we now know that if you are pregnant and you get COVID, you are much more likely to end up requiring admission to hospital. You are more likely, compared to people that are not pregnant, to need help with your breathing. You are more likely to end up in intensive care. You are more likely to have a stillbirth. You're more likely to need to have your baby prematurely and to be delivered by caesarean section. And very, very sadly, you are more likely to die. We know in Birmingham that pregnant women have died because of COVID. We know women have lost their babies because of COVID. And we also know that the vast majority of them, over 98% of them, aren't vaccinated. And when COVID started in the hospital, and like I say, being the DCMO, we did have to change how the hospital worked very, very rapidly. And that involved stopping elective operations, so planned operations where the condition wasn't life-threatening. We stopped these operations. Non-urgent clinic appointments were stopped until we could get face-to-face up because we were in lockdown, people couldn't come to hospital. And that meant that we had staff that would normally be doing these clinics or doing these operating lists that weren't, so we moved them over to do more of the pregnancy care stuff. We had to work in a different way where we had areas for COVID positive women or suspected COVID positive women. We had lots of staff off because of shielding or isolating or sickness. And we had to use the staff in a very different way. And because the workload across at the Queen Elizabeth was quite high, we split the consultant team. So we had a specific team, the Enhanced Maternal Care Outreach team of 8 consultants and 2 or 3 specialist midwives who would go across and see all the pregnant women across at the QE, because COVID affects pregnant women differently, and the parameters for the non-pregnant state, where you might need to use oxygen therapy, where you might need to use breathing machines to help people with their breathing, are different when you're pregnant because the unborn baby needs oxygen, so they need a bit more oxygen on board than people that aren't pregnant. And the staff across that don't normally look after pregnant women aren't skilled in that area. So that's where we had to go over. and see all the pregnant women that were in patients. Now, they were scattered throughout the Queen Elizabeth, so we had women in the respiratory wards, in the acute medical unit, and also in intensive care, and spread throughout different areas in intensive care. So when we went over, we would need to don full PPE, which takes time to put on. You then go in to see the women. And I have to say that when intensive care was really, really busy, it was a very harrowing environment to be in, to see the volume of people on ventilators, the fact that it was no longer one bed in each bed space, it was two beds, sometimes three beds in one bed space, because they were so busy. Instead of having, one or two nurses per patient, you would maybe have one or two nurses per 6 patients because of the staffing problems. And going in and seeing otherwise fit, healthy young women so sick during pregnancy, no visitors allowed in. The other aspect, work-wise, that is quite difficult is we've had some women whose babies have not survived because of COVID, who have had stillbirths, and the tests that we do afterwards and looking at the placenta, we can see how badly infected the placenta has been with COVID. And then sitting and explaining that to women that their babies died because of COVID, and the questions that they have about, why didn't anybody tell me that this was a risk? Why didn't we know this? Why weren't we offered vaccines that could have prevented this? My baby might have been alive if I had known, if I'd been able to get a vaccine, it might have stopped that. And that is really hard because they're probably right. And the information that is out there now, and the campaign that is out there now is, please, please, if you're pregnant, get your vaccine. If you're planning a pregnancy, get vaccinated beforehand and have your boosters when they're offered. If you just Google RCOG, which is the Royal College of Obstetricians and Gynecologists, if you Google RCOG COVID, it takes you to the COVID site. It has got patient information leaflets there. It's got decision-making aids there to help pregnant women navigate through the different questions they have. And there's also a page of frequently asked questions where all the things you're thinking, people have already asked and the answers are there. That information's updated all the time, and it's a really valuable resource. I would advise young women who, hopefully very young women aren't thinking about pregnancy now, but will in the future, is to think about always optimising your health and well-being before you get pregnant. There is no doubt that a healthy mum is much more likely to have a healthy baby. And it's just thinking about things. Having a baby is a big deal. Plan it. Think about it and plan it. And make sure that you get pregnant when you're ready to. Think about your lifestyle in preparation for pregnancy. We know smoking is really bad for pregnancy. Don't smoke. We know that obesity has a major impact on pregnancy, on getting pregnant in the first place as well. Think about what you eat, your weight, your lifestyle, exercise before you get pregnant. A normal weight, non-smoking, good balanced diet and regular exercise gets you in the best possible shape to have a baby, and that then means the best possible outcome in a pregnancy. In the context of COVID, get vaccinated beforehand. Then all these worries about a vaccine during pregnancy go away because you're already vaccinated, but take any boosters as they come along. COVID in pregnancy is not good, and there are plenty of things that we can do to reduce that risk. In terms of what it means to me being a doctor, I thought about that when I was about 14 or 15, that I would like to be a doctor, and it was a bit of a pipe dream. I came from a background where nobody in my family had ever been to university before. My big sister was the first person in my whole extended family that ever went to university, and I was always told by my parents, there is nothing you can't achieve if you don't put your mind to it. If you put your mind to it. And if you want to be a doctor, you go ahead and you do that. Went to medical school, became a doctor, best thing I ever did. And you don't need to come from a family of doctors to do it. Yes, it's hard work. It's a 5-year course. You need to work hard. But the rewards that you get, I wouldn't change it for the world. I've been a doctor since I qualified in 1985. So that gives you an idea of how old I am. I've been a doctor for a long, long time and wouldn't change a minute. It's hard work, but hugely rewarding. I went into obstetrics because I like the mix of surgery and medicine, and I get to do that. I'm a subspecialist in maternal and fetal medicine, so I still get to operate. I do cesarean sections, I do forceps deliveries and things like that. I do a lot of ultrasound. I look after women with pre-existing medical problems, so women with heart disease or kidney disease and things like that. So the medicine's still there. But on the whole, the majority of people I look after are fit and healthy. They're in the healthcare system because they want to be, because they're having a baby. They're not actually sick. They get a fantastic reward at the end because they get a baby, and then they go away. It's not like I have the same patients over and over for years and years thinking they're not getting better. They get a great reward at the end of it. Yes, there are downsides to it as well. There are difficult and sad things, but just being there and helping support families through difficult times as well that happened, is actually really rewarding. What I would say that is really, really important is if you're going to go into medicine as a career, there's a lot of studying, there's a lot of work, there's a lot of hours, it is busy. I managed to do it as a woman. I had 3 kids. I worked full time all the way through. You can have it all, but you have to do it because you want to. Don't go into medicine because somebody else wants you to do it. I see lots of doctors who do medicine because their parents want them to do it and not because they want to do it. And they're never quite as passionate and as good doctors as the people that go into it because that's what they want to do and they're passionate about it. So if this is something you want, fantastically rewarding career, but you have to want to do it and you have to love it.
And a little bit about what your offer is to young people in Birmingham who want to do anything.
It can be really difficult when you are at school and thinking about what do I want to do with my life. And lots of kids don't know what they want to do. I've had some of my children didn't know what they wanted to do at that stage. And some people do. Some people think, well, I might want to, I'm just not sure, I'd like to find out a little bit more about it. There's healthcare all around you. When you look around you, there are GP practices, there are hospitals, there are nurses, doctors, midwives, paramedics, pharmacists. There's all these people there. Reach out, talk to them. We do offer work experience to people in lots of different places. I've looked after quite a few school kids that have come through saying, I think I want to do X, Y, or Z. And they can come and spend a bit of time in the workplace and have a look and see. I had somebody that came to do work experience because they thought they wanted to be a doctor. After 2 weeks in the hospital at the Women's, they decided, no, I want to be a midwife. That's what I want to do, and they found their place. And they are now a midwife and have worked with us for a few years. There are other people that have come in thinking, I want to be a doctor, and then thought, actually, I really don't want to be a doctor, and that's fine. Better to find out before you start on that career path at university. But there are lots of opportunities and lots of people offer work experience. It can be difficult to navigate your way around that. Reach out. Just reach out, talk to your own GP, contact me at the hospital, family, friends, anybody that the school might be able to help. But there are lots of places that are very keen to try and attract. We need so many more nurses, doctors, midwives across the patch. And recruitment is really important. Everybody will be keen to try and help people that are interested to find out a bit more, to see, is this what I want to do, and help guide them on that career path and find their way.